Hello everybody, my name's Jenny. Welcome to my YouTube's channel. I'm going to take a small break from methamphetamines for a moment, and I just kind of want to let you guys know what it is that I'm doing on this YouTube's page. As you can see in the background behind, there's been an article in the news recently that has kind of disparaged people who are not physicians calling themselves doctor. If you have read the highlight of my page, you know that I am pursuing my DNP, which is Doctorate of Nursing Practice. And I just kind of want to clear up the air to let you all know what a DNP is, and at the end of it, what that means for me. So, like I said, the DNP is a Doctor of Nursing Practice, and really the big difference with the DNP and the PhD in nursing is that PhDs generally have about a 3 to 5 year course track, and at the end of it, they have original research that they will publish in the forms of dissertations or through several papers, etc. And the DNP is more of a collection of literature that already exists. So I'm not making my own original research. It's more like I've collected information on a topic, and then it's getting the information out there. And you'll see that throughout my YouTube channel, right? So when I started traveling the world doing anesthesia all around the country, there were a lot of conflicting ideas or misunderstandings about what to do for patients who are methamphetamine substance use disorder patients. And some people, they weren't sure if we should cancel the patient if they were tested positive for amphetamines or methamphetamines. Everybody kind of knew that they might be hypertensive or hypotensive, or if you did have to take them to surgery, that maybe they would be a little less responsive to medications. But there was a lot of confusion. Could they do neuroaxial anesthesia? What medications should you avoid? What medications should you definitely give? So it was fate that kind of led me to that question, which led me in part to pursuing my DNP. Also, part of the very important thing for me to get my DNP was so that I could teach. I love to teach, and it's my goal at the end of it to be able to teach SRNAs anesthesia so that they can go forth and do like I have done. It's very upsetting to see articles like this that disparage not only females, but just anybody who isn't a physician calling themselves doctor. Physicians, if you really want to get nitpicky, only own the title physician. They don't own the title doctor. As you can see, Dr. Jill Biden herself is an EDD. I'm pursuing my DNP. There's other nurses who are pursuing their PhD. And it's not just nurses, it's the pursuit of higher education for a lot of people. And it's sad that the misunderstanding or maybe the pursuit that people used to take. I know he talks about back in the day, well, I mean, back in the day we used to do ether drop anesthesia, but that doesn't mean that it was better, So it's unfortunate, but I want to thank you guys all for stopping to my YouTube page. This is a huge part of my pursuing the DNP. In addition to creating the educational offering, is definitely distribution of this educational offering and evaluation. Is it any good? So forth and so on. So if you're here, it's probably in part because of my survey. Thank you so much. I could not do this without you guys. I know this is not necessarily the path that I wanted to take, but COVID has changed the way that we do a lot of things, and I am certainly not a professional YouTube's person. This is just me in my little home office, surrounded by my very messy desk, trying to make videos as my 6-month-old daughter naps. So, thank you guys. I'm sorry that the author of this opinion piece is so confused, but I rest assured that when I am done with my doctorate, I will surely be calling myself Dr. Jenny, and it will be a relief after these 3 years of grueling education. So again, thank you. Join us back for our final installment of methamphetamine substance use disorder patients and anesthesia considerations, practice considerations for the anesthesia professional. Thanks again for stopping by. See you soon.